If Americans are to have the courage to change in a difficult time, we must first be secure in our most basic needs. Tonight, I want to talk to you about the most critical thing we can do to build that security. This healthcare system of ours is badly broken, and it is time to fix it.
Health Action Conference attendees are dedicated to repairing a system that is broken for far too many. And for 25 years, we have been the heart of advocacy for healthcare reform. Families USA started the Health Action Conference in 1995. The goal? To provide opportunities for advocates to come together to learn more about the issues and develop effective strategies. The conference convenes America's brightest, most influential and diverse advocates from across the country. We speak up for those who are disproportionately impacted by the healthcare divide, including women, seniors, children, minorities, and people with disabilities. The conference also draws organized labor, health service providers, and faith groups. We make our voices heard beyond our annual event. In 1997, we supported and worked for the passage of the Children's Health Insurance Program, CHIP, that provides important coverage for uninsured children. In 2008, we headed to the Democratic National Convention to make healthcare a key issue in the election. And it worked. In the years that followed, we harnessed our power to implement the Affordable Care Act.
So I could not be prouder of you, Families USA. Thank you for your extraordinary work.
Then we turned our sights from implementation to preservation. In 2012, we had to fight hard for the ACA in the Supreme Court. And again in 2015, when yet another lawsuit threatened to take healthcare away from millions of Americans, Families USA developed a campaign to push back against King versus Burwell, and the High Court struck it down. Since then, there have been relentless attacks to repeal ACA, and we have fought back and pressured lawmakers every step of the way. But our fight is not over. Affordable health care is still in the balance for millions. Out-of-control prescription drugs, surprise medical bills, lack of access to oral health care, attempts to annihilate Medicaid. So we are paving a new path forward with transformation. We are working hard to improve how consumers experience health care, to lower costs, improve quality and outcomes, and to change what health really means. And we are putting America's consumers and families at the center of our work to draw our solutions around their experience. The future of the healthcare movement is expanding to harness this transformation through value, equity, affordability, and consumer experience, all so that America's families can receive high-quality health care without threatening their financial security, and so no family faces barriers to achieving their optimal health. That's why, after 25 years, we can't stop now. And we remain committed to making Health Action a forum to hear and share timely, powerful messages and critical updates and insights from state and national leaders. We learn and we share field strategies, tactics, and best practices to strengthen and sharpen advocacy skills, to make our voices heard, to make a change. And, most importantly, we are a relentless network of advocates from across the country who won't sit down when now, more than ever, we must stand for high-quality, affordable health care for all. We are Health Action, and Health Action is you. We have work before us. Our nation's health is in the balance. We must fight to not only keep our hard-won gains, but expand and improve what we have. Together, each of you, all of us, we fulfill our mission of building a nation where no one faces barriers to health or health care because of who they are, where they were born, or where they live. Let's do it. Health Action.